Do you suffer from dizziness and have neck pain, and all of your exercises seem to make your neck pain worse? Today's video is going to discuss my top 3 solutions in dealing with having dizziness, but also a coexisting condition of cervicogenic or neck dizziness and pain. So for those of you that don't know me, my name is Amy McMillan. I'm a mobile vestibular therapist in Northeast Ohio, and I have this channel to give you tips and tricks on how to treat your dizziness at home. So if you are in the midst of vestibular therapy or starting anything for the inner ear or brain, you probably are getting a lot of exercises that involve like moving the head back and forth. So if you've had an inner ear infection or concussion and you start your VRT exercises or your gaze stability, the foundation for regaining that interaction between the inner ear and balance is to do a lot of like head motion. However, I know a lot of patients get cervicogenic dizziness. Now, why that happens is that when something happens, our neck kind of guards up. It's called our cervical colic reflex, and it kind of protects our head and keeps it stable on the spine so we don't move too much, causing dizziness. But if you are familiar with VRT or vestibular therapy, you know you have to move the head to activate that inner ear to reduce your dizziness. So what do you do if one seems to be causing the other? Well, a couple solutions that I have. Number one, you can shorten the amount of time of the exercise that seems to bother you. So if you're doing your head shake exercise, your VOR times 1, and your therapist is prescribing 1 minute and doing a quick head motion that seems to bother you, you can just do less time of that exercise and break it up. There's really no benefit for you to do pushing through and doing 1 minute straight through if it's just causing other problems. Go ahead and kind of chop it up into little bits. Maybe you do 2 30-seconds, or maybe you do 4 15-second reps, and you spread them out throughout the day. If that saves your neck, really the most important thing for the inner ear is that you start getting 12 to 20 minutes of these gaze stability exercises spread throughout the day. So that is tip number 1. Just modify, take little baby steps, and do what you can and preserve your neck. Step 2 would definitely be adding neck stretches and strengthening, postural strengthening to your concurrent vestibular therapy program. So I will go ahead and put one of my favorite videos up here in the corner for daily neck stretches that can kind of prep your neck and get you ready for those VRT exercises. I often have my clients put hot packs on their muscles or do a light massage or do these stretches before we even think about doing our inner ear exercises. This way we kind of push out any of that inflammation and lactic acid that might be stored in the neck from statically holding you and guarding you still, and would make your VRT exercises, your gaze stability, more tolerable. And then the last tip that I have is simply stopping the exercises that are causing headaches and cervicogenic dizziness. So with your gaze stability, your VRT exercises, they are meant to increase your dizziness up a couple points past baseline, and then after a few minutes, they should come back down. If you're finding that your dizziness is just progressing and progressing and progressing and feeling more cervicogenic-like, what does that feel? Kind of like spacey in the head, floaty. It's not really spinning. It's kind of feeling like your head's in a fishbowl, maybe like your head is not attached to your body. Those are some of the things that I hear for cervicogenic dizziness. So if your exercises seem to be causing that dizziness that doesn't subside with rest, you may be irritating your neck and you want to stop that exercise. What do you do instead? I would suggest focusing on other things that work the inner ear, like bending forward and raising up, doing 180 turns, doing diagonals, like taking dishes out of the dishwasher, or pretend you are walking and shopping through the supermarket with a slow, controlled head motion. So you can still activate the ear in multiple ways by using the body through space without putting so much strain on your neck. Give yourself some time to heal. Maybe go to a neck specialist therapist. A lot of clinics have a therapist that deals with the neck and a therapist that deals with the inner ear. Sometimes you're lucky enough to have a therapist who can work with both. And just go ahead and take a break on those inner ear exercises. Give your neck some TLC, and then slowly incorporate one inner ear exercise at a time, making sure you can always bring your dizziness back down to baseline and get that neck pain and dizziness under control. Hopefully you found those tips helpful in your full recovery from your dizziness. If you have any questions, please leave them in the comments below. You know I love to answer them. And until I see you next week, stay healthy, stay steady, and stay strong.